I think it is important to review very briefly the historical aspect of informed consent, which was done very nicely by Dr. Taylor before me, just to point out two important issues that bear on my presentation. The first is that for centuries, the patient-physician relationship was a paternalistic relationship. In its historic and fundamental view, a paternalistic relationship needs no disclosure of information to patients and hence no informed consent at all. And as was stated earlier this evening, in the Hippocratic writings, not in the Hippocratic Oath, there are numerous occasions where Hippocrates supposedly tells his students, when you come to a patient's home to make a sick visit, and obviously in those days there weren't hospitals and patients were at home and physicians used to go to their home. When you come to their home, don't talk about their illness, don't ask them any questions, don't let them disturb you with your thinking and with the facts. You talk about the cows, the family, whatever surrounds the patient, and make your own decisions what is best for the patient. So a classic paternalistic patient relationship, patient-physician relationship, really involves no disclosure of information and no need for informed consent. And in this sense of informed consent, I'm not talking about, yes, doctor, do whatever you feel is right, and that would be some kind of a consent. We are talking about informed consent. This way of informed consent was really non-existent when the patient-physician relationship was a paternalistic one. This relationship has dramatically changed over the last 3-4 decades or a little bit more. And again, I will not discuss the informed consent issue on human experimentations, as the subject today is informed consent in clinical setup. It is said, and I'm not sure that this date is exact, but in 1957 was the first legal requirement in an American court for the concept of informed consent from a legal point of view. 10 years later, or about in 1966, the first legal court case in Israel mentioned the issue of informed consent. And as you may know, we in Israel import en bloc anything happening in the United States in about 10 years lag period. So here we have this concept here, and right away in this lag period, we got it over to Israel. So if we take an autonomistic patient-physician relationship, both disclosure of information and informed consent makes sense and actually is the outcome, the natural and necessary outcome of the concept. So that informed consent today, as viewed as, at least from an ethical point of view, is based on two interrelated principles. One is patient's autonomy, both from a social, ethical, and legal aspect, which is a major change from the paternalistic approach. And the second one is the self-ownership, that we own our body, and therefore we are the one to determine what is to be done with our body. So that the concept of autonomy, if we take it to its extreme, would mean that the physician is obligated to disclose anything the physician knows about the patient, so that the patient will be able to make his own decision concerning the body that he owns, and only he can make such a decision. So in the extreme way, there is no way and no room for a reasonable disclosure of information, because what is reasonable? Who decides what is reasonable? To me, one information is not reasonable, to another one it becomes reasonable, and where do we draw the line? So taking autonomy to its extreme really sets the stage for an unlimited disclosure of information and an unlimited obligation on the patient to make decisions and freeing completely the physician from any responsibility on the decision making once he imparted all that he knows as a physician to the patient.